Welcome to the deep dive. Have you ever had that sharp, sudden pain in your lower back?
Hmm.
And you immediately wonder, okay, did I just pull something? Or is this something serious like my kidneys?
Yeah, that's a really common fear and honestly a critical question to get right.
Right, because you don't want to panic over, say, a simple muscle spasm.
Exactly. Or even worse, brush off a genuine kidney problem thinking it's just stiffness.
So that's our mission today, isn't it? To kind of cut through that confusion.
Precisely. We want to give you some clear markers, things you can actually use to help tell the difference between serious renal pain and, well, more common lower back or column pain.
Okay, let's dive in. Because the symptoms, they can really seem similar sometimes.
They absolutely can. And maybe before we even talk about where it hurts,
Yeah.
we need to touch on this idea that it's often not just one single thing failing in isolation, you know?
Ah, the interconnectedness thing.
Exactly, the integrated view. Think about your body like, well, like a complex system. If there's an issue somewhere else, maybe chronic inflammation in your gut or liver trouble.
Or even just your gut bacteria being out of whack.
Yes, dysbiosis, exactly. That imbalance can actually trigger problems in both the lower back structures and the kidneys, almost at the same time. They're neighbors, anatomically speaking.
Okay, so a problem elsewhere could be the root cause making both areas complain. That's a useful context, even if it complicates things a bit.
It does, but it's crucial context.
All right, so bearing that systemic link in mind, what's the number one way, the sort of first check someone can do at home?
Okay, the primary rule, the core differentiator, often comes down to movement versus rest.
Movement versus rest, how so?
Generally speaking, true lumbar column pain from the spine's joints, muscles, ligaments down low that usually feels worse when you're moving.
Like bending, twisting, getting up?
Yes, exactly. Changing positions makes it flare up. But when you find a position, maybe lying down or sitting carefully, and you stay still, the pain often eases off a bit.
Okay, that makes sense.
Yeah.
If I move the structure complains more. So if walking it off makes it spike, I'm thinking column or muscles.
That's the typical pattern. Now, renal pain, kidney pain. It often behaves the opposite way.
The opposite, worse when still.
Often, yes. Significantly more intense, sometimes just excruciating, especially when you're lying quietly or trying to rest.
Huh. Why would resting make kidney pain worse? That seems counterintuitive.
Well, think about what causes kidney pain internally. Often it's swelling, or maybe a blockage like a stone. This creates constant, unrelenting pressure inside the kidney itself.
Okay.
When you're moving around, there's other input muscle sensations, joint movement. It kind of provides a distraction or maybe slightly shifts things internally. But when you lie perfectly still.
There's nothing else.
Yeah.
Just that internal pressure.
Exactly. That internal pressure becomes the main signal. It feels isolated, maximized, overwhelming because there's no physical noise to mask it.
Wow. Okay. That's a really powerful differentiator. Movement hurts more. Think column. Rest hurts more. Think kidney.
It's a great starting point, but there's always a but, isn't there?
Uh-oh. What's the complication here?
The major caveat is nerve compression. If you have a serious issue in the lower lumbar spine that's actually pinching a nerve, like the sciatic nerve,
Ah, sciatica.
right, then you can have intense, constant pain even when you're completely at rest because the nerve itself is being irritated continuously.
Got it. So nerve pinching breaks the rest rule.
Okay.
What about location? Are we even talking about the same area of the back?
Not quite, and this is another key clue. Renal pain feels internal, like it's deep inside, and it's usually located quite high up.
High. How high?
Thinking near the bottom of your rib cage, around the very last floating rib, but towards the back. People often describe it like a spike or something sharp stuck deep inside, just under that rib area.
A deep, high, internal stabbing feeling.
That's a common description, whereas typical lumbar or column pain is felt lower down.
More around the belt line.
Yeah, lower back, waist pain, lumbosacral area, generally below where you'd feel that kidney pain. That difference in height is pretty significant.
Okay, location is helpful. Now, you mentioned systemic issues earlier. What are those big red flags that really scream kidney problem, not just I slept funny?
This is absolutely crucial. Kidney issues, especially infections or severe blockages, they tend to make you feel systemically unwell, truly sick.
Like the flu.
Exactly. Think extreme fatigue, like you just cannot function, a profound sense of malaise, feeling really run down, and very importantly, fever,
Fever. Right.
hyperthermia. If you have significant back pain and a fever, you really need to consider a kidney cause very strongly. Purely mechanical back pain from a muscle or joint?
Doesn't usually cause fever.
almost never, unless maybe someone has an extreme pain sensitivity or a very rare secondary infection. So fever is a major warning sign for a renal issue.
Any other signs related to the kidneys themselves?
Yes, things related to the urinary tract.
Yeah.
Noticeable blood in the urine, that's hematuria,
Okay.
or a burning sensation down below when you urinate. That points toward the urinary system being involved.
And the pain itself, is it different?
Typically, yes. Kidney pain is often described as much more intense, very persistent, often stabbing or piercing. And it just doesn't seem to let up with anything you do. Changing position doesn't help much. Rest doesn't help. It's relentless.
Right. So recapping that, high internal pain, won't quit, maybe fever, feeling really sick, maybe urinary signs. That's a strong signal for kidney.
That's your urgent investigation cluster, yes.
But wait on, isn't there a muscle that lives right nearby that can fake kidney pain really well?
Ah, yes. The great imposter, the quadratus lumborum, the QL.
QL. Okay, what's that story?
It's a thick, pretty powerful muscle deep in the lower back. It helps stabilize your spine. And crucially, it sits right next to the kidney. We're talking just centimeters away.
Oh, wow. That close.
Extremely close. So if you get a severe spasm or a deep contraction in that QL muscle,
It feels like kidney pain.
it can feel identical, a really intense, sharp stabbing pain, like a dagger in your side or flank.
So if I've been, say, sitting awkwardly for hours, maybe stressed, and suddenly get that knife in the side feeling, that could just be the QL muscle freaking out.
That's a very classic presentation for a QL spasm, yes. It often comes on after prolonged sitting or unusual strain.
How would a doctor tell the difference then between QL and kidney?
Often, through careful palpation, actually feeling the area.
Cussing on it.
Yes. They might have you lie on your side to relax the area. Then they'll carefully feel deep between the spine and the outer back muscles. If they find a very tight, ropey band of muscle, the QL, and pressing on it reproduces that exact sharp pain you've been feeling.
Then it's likely the muscle.
It strongly suggests a muscular origin, yes.
Okay, so we've got the kidney internal, systemic signs, the column lower, worse with movement, and the QL muscle mimicking kidney pain, but maybe triggered by posture and identifiable by touch.
Those are the main players in that immediate area.
Now let's circle back to that very first point about the body being connected. You mentioned gut health, liver. How does that fit in again?
Right, the visceral connection. It reinforces that global unity idea. Problems deeper inside, like with the pancreas, the duodenum, the stomach, the liver, or even just that gut dysbiosis we mentioned.
They can send pain signals elsewhere.
Exactly. They can cause referred pain. The pain signal travels along shared nerve pathways and shows up in your back. And this referred pain can feel very much like column pain, or it can mimic kidney pain.
So my back could hurt because my digestion is off.
It's absolutely possible. And it means if you only treat the back symptom without looking for and addressing that underlying visceral issue, the back pain will likely just keep coming back.
That's a crucial point about looking deeper. Okay, let's shift focus specifically to the lumbar column itself. What are the common structural problems we actually see on things like MRIs that cause that lower back pain?
Well, probably the most common, especially as people age, is arthrosis.
Which is basically degeneration.
Yes, wear and tear, degeneration, and sometimes deformation of the joints between the vertebrae or the big joints where the spine connects to the pelvis, the sacroiliac joints. This leads to inflammation, stiffness, pain.
Makes sense. And then there are the discs. Everyone talks about discs. Bulging, slipped, herniated.
Yeah.
What do those mean?
Right, the intervertebral discs.
Yeah.
Think of them as little jelly-filled cushions between your spinal bones. They provide shock absorption.
Okay.
Now, a bulging disc, sometimes called a protrusion, is like, imagine a tire bulging when it's low on air. The disc loses height and sort of sags outwards, maybe pinching things slightly.
Annoying, but maybe not catastrophic.
It can be painful, certainly, but the more serious issue is usually a hernia or an extrusion.
That sounds worse.
It is.
Yeah.
That's when the outer wall of the disc actually tears or ruptures, and the inner jelly-like material, the nucleus pulposus, squeezes out.
And that's what causes the big problems.
Yeah. That's often when you get significant nerve compression. That displaced disc material can press directly onto the nerve roots exiting the spine.
Like the sciatic nerve.
Most famously, yes. When that happens, you get that characteristic pain radiating down the back of the leg. That's lumbosciatalgia.
Lumbosciatalgia, which is really just the technical term for sciatica, that shooting pain from the buttock down the leg.
Exactly. Pain following the path of the sciatic nerve. Less commonly, it might compress the crural nerve.
Causing pain where?
That usually sends pain down the front of the thigh towards the groin area.
Okay. So discs can cause local back pain or radiating nerve pain like sciatica. Now, what about things nearby that get confused with low back pain? I know the hip often comes up.
Yes, definitely. People often say my hip hurts and point to their waist or lower back. But anatomically, the hip joint is where your thigh bone, the femur, meets your pelvis.
Down lower and more to the front or side.
Exactly. And pain originating from the hip joint itself, like from hip arthrosis or pinching, it typically starts in the groin.
A groin area.
Oh, it might radiate backwards toward the buttock sometimes, but if the main pain is deep in the groin, you should think hip joint first, not necessarily lower back.
That's a helpful distinction.
Yeah.
Groin points to hip.
Mm.
What's the other common point of confusion? Something called piriformis syndrome.
Ah, the piriformis muscle. Yes. This is another muscle deep in the buttock region, underneath the main glute muscles.
Okay.
When this small muscle gets tight or spasmed, it can also irritate the sciatic nerve, which runs right underneath or sometimes even through it.
So it causes sciatica-like pain too.
It does. Sharp, sometimes knife-like pain felt deep in the buttock, often radiating down the leg, mimicking true spinal sciatica.
How do you tell that apart?
The key differentiator for piriformis syndrome is often sitting.
Sitting makes it worse.
Significantly worse. When you sit, especially on a hard surface, it compresses or stretches the piriformis muscle right where the nerve is. People often describe it as feeling like they're sitting on a walnut or even a spike or a needle right in their buttock cheek. Yeah. It makes them want to constantly shift their weight, stand up, walk around, anything but sit still. That intense aggravation with sitting is a big clue for the piriformis.
That's very specific. Okay, so we've mapped out the area, the symptoms, the mimics. Let's say someone listens to this and based on the signs, maybe high pain, fever, feeling really unwell, they strongly suspect it is a kidney issue. What's the immediate plan?
The immediate plan is don't wait. Seek professional medical attention right away. Go to your doctor, urgent care, or the ER, depending on severity.
And what will they do?
They'll do a proper clinical evaluation, likely including that fist progression test over the kidney area.
Punyo percussion?
Yes. And they'll almost certainly order diagnostic tests, maybe blood tests, urine tests, and definitely imaging.
Like ultrasound?
Ultrasound echography is very common first step for kidneys. Or they might use a CT scan, tomography, or possibly an MRI, depending on what they suspect. You need imaging to see if there's a stone, a blockage, swelling, or infection.
Okay. Get checked out, get imaged. And once a renal issue is confirmed, what's the most fundamental thing to do, therapeutically speaking?
It sounds almost too simple, but the #1 therapeutic target, especially for things like stones or mild inflammation, is hydration, water.
Just drinking water.
Lots of it, unless your doctor specifically tells you otherwise due to another condition. The goal is to help reactivate the kidneys, flush the system, dilute the urine. Aiming for at least 2 liters a day is a standard recommendation.
So hydration is key. What else might be involved?
Well, if there's a bacterial infection, obviously antibiotics are crucial. Sometimes specific supplements might be suggested to support kidney or liver function, like milk thistle or dandelion, but that's secondary to addressing the core issue and hydration.
And is it true kidney problems can affect other things, like blood pressure?
Oh, absolutely. Kidney function is directly linked to blood pressure regulation. So kidney failure or significant dysfunction can definitely contribute to high blood pressure, hypertension, especially if someone already has that metabolic tendency.
It all comes back to that interconnectedness again.
It really does. The body works as a whole system.
Okay, this has been incredibly helpful. Let's try to quickly summarize the absolute key takeaways for someone trying to differentiate right now.
All right. If the pain is high up, near your back ribs, feels deep and internal, is relentless, maybe comes with fever, feeling generally very unwell, or urinary changes.
Think kidney first and get it checked professionally.
Yes. If the pain is lower, more around your waist or belt line, clearly gets worse when you move or change positions, and you feel otherwise okay, no fever, no systemic illness.
Then you're leaning more towards the column, muscles, or joints.
That's the general split. But remember, those overlaps severe nerve compression can cause pain at rest, and that QL muscle can perfectly mimic kidney pain.
So professional assessment is still key if unsure or if symptoms are severe.
Always.
We started this whole deep dive talking about how the body is an integrated system, how gut health or metabolism might play a role. So maybe that's where we leave our final thought for the listener.
Exactly. Once the immediate crisis is managed, You've treated the acute back strain, or you've dealt with the kidney stone or infection. Maybe pause and ask that deeper question.
Which is,
What underlying factors might have made me vulnerable to this in the first place? Was there ongoing inflammation? Is my gut microbiome healthy? Is my metabolism working optimally? Could addressing those systemic things prevent this from happening again?
looking beyond the symptom to the root cause within the whole system.
That's the path to truly optimizing your overall health, not just fixing the immediate pain point.
A really powerful idea to reflect on. Thanks for joining us for the deep dive.